Hello, this is Dr. Martorell. I'm going to be discussing the topic of vaginal yeast infections. Vaginal yeast infections are also called vaginitis or vaginal candidiasis, and they are a very common problem in women. Symptoms are itchiness and irritation of the vulva and around the opening of the vagina. Men can also be affected by this infection. Yeast infections usually occur infrequently, but they can recur frequently and may cause chronic persistent symptoms in some people. May occur mainly in women who have their menstrual period. They are also less common in postmenopausal women who do not use estrogen-containing hormone therapy. The most common symptoms include itchiness and irritation of the vulva and around the vaginal opening. Pain with urination is common, vulvar soreness and irritation, pain with intercourse, redness or swollen vulvar or vaginal tissue. Some people have a whitish, curdy vaginal discharge. Some people may not. Some people may report clumpy, curd-like, watery vaginal discharge. Sometimes it is difficult for the person to know what type of infection they have. Symptoms of yeast infection can be very similar to other conditions, including bacterial vaginosis, trichomonas, and dermatitis. Usually the fungus that causes infections is Candida. It lives in the gastrointestinal tract and the vagina. Usually Candida causes no symptoms. However, when there is changes in the environment or flora of the gastrointestinal tract and or vagina, which can be caused by medications, injury, or stress to the immune system, then this particular fungus can overgrow and it causes the symptoms of an active infection. Some of the risk factors that may lead to increased chances of developing an infection include antibiotics, hormonal contraceptives like birth control pills, patch and the vaginal ring, contraceptive devices, vaginal sponges, diaphragm or intrauterine devices, a weakened immune system, which can be caused by medical conditions like diabetes, the use of steroids or HIV, among others. Pregnancy is a risk factor for this infection. People with diabetes are at increased risk for yeast infections, especially if the blood sugar is not well controlled, and sexual activity. Vaginal yeast infections are not a sexually transmitted infection, but they can be transmitted during sexual activity. The provider may need to examine and obtain samples and cultures. There is also a way that the person can do a swab and submit it to see if there is fungal infection or other type of infection. Treatment may include pills, but it may also include topical or vaginal creams. It is usually about 7 days of an antifungal cream that can be applied with an applicator on a daily basis. The length of treatment may depend on the severity and type of infection that the person has. There are several oral treatments. A very common one that is used is fluconazole or diflucan. Some women may need one dose. Some people may need more than one dose depending on the site of infection and how complicated the infection may be. Most yeast infections may go away within a few days of starting treatment. However, some people may develop recurrent vaginal yeast infections, and this happens in about 5 to 9% of women that have vaginal infections. A recurrent infection is defined as 3 or more confirmed infections per year. It is important to diagnose correctly and make sure that there is no other infection going on. And when a person has a recurrent vaginal infection, they may need to be on longer treatment courses for these infections. There is also suppression treatment that would help decrease the frequency and severity of vaginal infections, and some people may need suppression treatment to prevent these infections from coming back. Vaginal yeast infections is not a sexually transmitted infection, although the infection can be passed from one partner to another. In some situations, some sexual partners may need to be treated, especially if they have an active, confirmed infection. Sporadic attacks of vulvovaginal candida may occur without an identifiable risk factor. There is no good evidence showing a link between vulvovaginal candida and hygienic habits or wearing tight or synthetic clothing. I hope that this topic was helpful. Please talk to your provider or call the office if you have any questions. Also, please like, share, and join my other social media outlets. Please feel free to make any comments below, and thank you. See you soon.